outset, let me thank the organizers for giving me this opportunity. And I also sincerely apologize on behalf of Dr. Bindu Menon, who is not able to be present for the session. For the next 30 minutes or so, I shall be talking about the impact of COVID-19 on younger population from a mental health professional perspective. So yeah, I'll introduce you to the topic. Pandemics can be considered as a flip side of globalization. Like as a social animal, we are living in a global village. So there are advantages and disadvantages. So historically, ever since the epidemics of cholera, plague, and even the flu, that is the 1920 Spanish flu, the pandemic has all devastated populations, but none of them have reached the scale of COVID-19. If you look at the statistics, almost 4.31 crores people in India have been affected, and the mortality as of today is 5.24 lakhs. And the economic burden is just mind-boggling. We are still coming to terms with what is happening, and we are told that it is no means over. So let's look at some statistical counts of what COVID-19 has done to us. Next slide, please. Yeah. So this is a study conducted by the UNICEF, in which a rapid assessment of close to 8,500 adolescents and young people between the ages of 13 and 29 were randomly selected across the globe, that is among the 7 continents and several countries. So among these participants, 27% reported feeling anxious, and 15% of these people satisfied the criteria of a major depressive disorder. For about 30%, the main reason influencing their current emotional state was economic situation. 46% reported of having less motivation to do activities that they previously used to enjoy. Next slide. 36% feel less motivated even to do their regular chores. And if you compare male and females, 43% of young women between the age of 13 and 29 felt pessimistic about their future compared to only 31% of men. So among those who felt the need to ask for help regarding their physical and mental well-being, 1 in 3 only asked for help from a closest circle of family and friends. So what could be the contributory factors? So it was identified that the home confinement of children and adolescents, that too in a very unexpected manner associated with uncertainty and anxiety, they led to disruption of education and getting used to a system which they were not previously used to, and reduction in physical activities and opportunities to socialize. So in the absence of a structured environment of a school or college, disrupted their daily routine, which in fact caused boredom and lack of new ideas for engaging in various academic and extracurricular activities. So ultimately what happened was this lowers the level of affect, the emotional response in children and the young adolescents and younger population. They gradually came down. The younger children started becoming more clingy, and they were more attention seeking, and they were more anxious and tend to be more dependent on parents. On the other hand, older children and the youth, they were anxious more about the cancellation of exams, exchange programs, difficulty in submitting their projects on time, worrying about having to compete with their peers, and other academic events. Also, digital learning, which was an unfamiliar terrain. So, the learning through a digital portal would require access to a computer or a laptop or even a mobile phone that remained unattainable for students belonging to lower income groups. So now what is the statistical data that we have on this is according to the National Sample Survey, 24% of household have an internet facility and only 8% of all household with members aged between 5 and 24 have both internet and computer connection. So now how this affected the students is that the having to submit the assignments online or to attend the online classes, so this build significant amount of stress in the students. So this affected their mental health. Next slide. Yeah. So this build up anxiety, depression, severe sleep issues, and in extreme cases suicidal attempts also. So disengagement in academics made them vulnerable to dropping out, changing professions very frequently, thinking that they will not be able to cope up with the current schedule, and future worries regarding unemployment. And this also increased the incidence of psychiatric disorders like depression, anxiety, substance use disorders like increased use of alcohol, tobacco, um, cannabis, and also uh, the uh, possibility of developing a post-traumatic stress disorder. So this was the mental health perspective. Now, this long-standing stress can also cause physical problems like metabolic syndrome, obesity, increased weight gain, and reduced insulin sensitivity, as well as the reduction of life expectancy due to increased stress. Also, it has been estimated by the Center for Monitoring Indian Economy that unemployment shot up to 23% in rural setting and 30% in urban settings. What happened to workspace and livelihood? So, unemployment and poverty on one side, closing down of small businesses like retailers and so-called non-essential services, and restriction of movement in public space. People were asked to confine to their house, and they were asked to work from home and learn from home. So we will talk about that more during the later slides. What is the social impact of COVID-19? So the social relationships decreased significantly and face-to-face interactions were very less due to quarantine issues, due to isolation, due to fear of contracting illness, and due to difficulty in traveling. All the social relationships were deeply affected, and people were forced to interact with limited number of people, and that magnified the existing friction, and this resulted in breaking down of relationships. So if you take a data of 1 or 2 years, we could see that the number of divorces and relationship breakups as well as interpersonal issues were more. So also the young females were forced to do more household chores rather than spending time in studies or researches, and many of them were forced to get married due to financial burden. So there has always also been reports of domestic and sexual violence, child abuse, both physical, emotional, and sexual, during this last 2 years. And the mental health was affected Like I said, people had anxiety, people had depression, post-traumatic disorders, difficulty to go to a psychiatrist or a mental health professional due to stigmatization. All these had. But among those, COVID anxiety took the maximum uh, number, as there was discrimination among the COVID patients themselves, being the potential source of infection. Even if you look at the news stories, you could see that people were, discarded. People were denied access to their own family because of the scare that they will be a potential source of infection, and they were asked to stay outside. You must have seen in photographs in the news itself that people were thrown out. People who came from abroad were not able to allow to enter the house, and they took refuge in their in these first line centers. So all these were because of the anxiety that they will be also exposed, and they will also be infected. So the xenophobic responses to those coming from the endemic areas. If you were remember the scene at Kerala, Tamil Nadu, and Kerala Karnataka border during this recent lockdown, people were anxious. So people were not, if it was an endemic area, people were not allowed to come to one particular state because of the scare of having to contract the illness again. So we could say that our worst prejudices were on display. Also, lack of a buffering system. So now, normally, you will all have certain friendships or work relationships act as a shock absorber. So, in a normal scenario, people are able to get away and dilute the impact of toxicity at home, if at all. If there is a significant interpersonal issues between father and mother, or father and children, or mother and children, or grandparents. So, this window period of going out to the office or school would have been a solution to their problems, and that would have diluted the impact of a stressful situation. But the quarantine, the isolation, or having the COVID-19 infection itself restricted the movement, and also recreational centers like sports, gyms, entertainment avenues like theaters were closed, and these forced people to find hobbies which were restricted to the home atmosphere. Also, people started depending upon electronic gadgets like mobile phones, laptops, and other things to find more entertainment. So the buffer system was lacking, and hence the problems actually exaggerated. What was the impact on already pre-existing mentally ill people? So they had lack of access to medications and opportunities for treatment. So those who were on consistent medication for chronic medical conditions or even psychiatric conditions, so they did not have access to go out and purchase medicines, consult the doctor. Many of them were not aware of online consultations, telephonic consultations. So initial time of this COVID-19, we had a crisis situation of having been not able to communicate with the patients. Same way with them also. They did not have access to the doctors or to the medications. So there was a worsening of symptoms. You could see a peak of worsening of symptoms because of psychosocial stressors. Like I said, the financial problems, the sleep issues, a family member being sick, having to take care of older grandparents with other medical issues. These are all psychosocial stressors. So on a vulnerable population, there were worsening of symptoms. So most mental illnesses are overdetermined. I mean, what I meant to say is that all the mental disorders will have a worsening if there is a pre-existing psychosocial stressors with a biological stressor. That is, this COVID-19 was a biological stressor. So with the other psychosocial stressors, the mental disorders, all of them had worsened uh, presentation during this situation. So those children or young population with special needs like autism spectrum disorders, attention deficit hyperactivity disorders, obsessive compulsive disorders, they encountered more challenges. As you all know, that COVID-19 is a pandemic, and the scare was that you have to sanitize your hands, you have to keep your face and hands clean all the time. So if you consider a person with obsessive compulsive disorder, where they already have that feeling of being contaminated all the time, they had an aggravation of symptoms, having to wash their hands more often, having to use sanitizer very often. That and due to these enforced restrictions, all their symptoms were aggravated, which in turn increased the level of anxiety. And if you look at autism and attention deficit hyperactive disorder, uh, they the autistic kids or children are not familiar. They don't get adjusted to a frequently changing environment. So they need to follow a regular routine. So when they had quarantine, when they had to be quarantined, when they had to be isolated, so due to an unfriendly environment, which they are not very used to, they also had aggravation of their symptoms, like the inattention increased, the hyperactivity in children increased. So they were also vulnerable to have worsening of their symptoms. How all this has affected young people. So, post COVID, we have been getting many patients who complained that there was a constant friction between the parents and also with the other siblings. So, lack of access to healthy entertainment avenues and increased electronic gadget dependence, leading to addiction to social media and also unhealthy habits like accessing porn sites, gambling sites, and also gaming sites. And this has also changed their eating habits and sleeping habits. And this has resulted in a significant academic decline and and that caused frustration in both students as well as their parents. So let's look at a case history. I have seen this patient very recently. She's a 14-year-old girl, and she was very normal. She had normal birth and development. Everything is fine. She was a brilliant academic performer. She had other extracurricular activities. She was a good daughter. She had so many other friends. Everything was all right. So, what happened following lockdown 2 years back? After being given a smartphone for attending online classes, the child shortly started spending excessive time on the mobile using social media and started chatting with strangers that she met online. So, when the parents would try to restrict the mobile usage, she was verbally abusing them, often using vulgar language which she previously never used to. Parents later noticed that she was spending time in WhatsApp groups using vulgar language, writing down vulgar words in her notebooks. She thought that she would be easily fitting in if she did so. She was taking selfies holding money, posing with cigarettes as if she is smoking, and allegedly posting it online. On one instance, she stole her brother's mobile and gave it to one of the boys that she met online as a helping gesture. She was not studying, she was not taking baths regularly. She was also not eating properly. So eventually the parents took her to a counseling session. After giving considerable amount of sessions, no improvement was noted. She would continue to demand a mobile phone and would make suicidal threats if denied. She was allegedly getting into virtual relationships with boys and would manipulate them into arguing with one another. She was also making superficial cuts on her forearm and would send pictures of these cuts to the boys, threatening them when she gets into arguments with them. She was also impersonating her mother and would chat from mother's account with various other people online. So what happened was ultimately the mother lost her job when the school authorities found out this incident. She expressed no remorse, and when parents confronted her regarding this behavior, she was again aggressive on them. She was changed school. In the new school also, she was getting into arguments with older children for minor provocations, and from there also parents were receiving complaints. So if you interview this child, she would say that she was doing all this only because she was feeling bored, and she would find these activities be interesting for her. So around 3 weeks back, she skipped school to meet the boys she met online without informing anybody, and was later found out after one day with the help of police. So what do you understand from this one particular case incident? So she was given a mobile phone, but that doesn't mean that mobile phone is the cause for all her problems. So it was mandatory to give the mobile phone because that was the learning method. Okay, all the classes were online and they did not have any other method to continue her classes. So mobile phone, yes, it was given to her, but where things went wrong? Okay, so it was it is to be thought that proper supervision was not done. It is not only the fault of the student. The parental supervision was not there. Okay, so they were not paying attention properly. They did not have a healthy conversation. They did not take the situation a grave one to identify what her problems are. They did not seek help at the right time. So the students uh, who pursued all this academics for the past 2 years, they are considered as the corona batch. Okay, but why is it so? Because all cannot be negative. There has been positive impacts on the students as well. Students learn to develop new hobbies, new talents, online businesses, discovery of new potential in homemakers. Like you have seen YouTube videos of new things, creative things being made and being posted. And also how the need for becoming digital has also been encouraged. And webinars, the so-called digital conferences and e-learning, that has all reduced the expenses. Um, what can parents do to help the youth? The parents can actually observe for any emotional and behavioral changes in their children. Sometimes these changes can be very subtle, very minor. They can listen to them, reassure them, generate hope, and provide emotional support and develop a sense of trust. So if you feel that the changes are severe with significant loss of appetite or sleep, or if there is a physical aggression towards others, or if they express wishes to die or to commit suicide, do not hesitate to take a professional help. So to conclude this session, COVID-19 is too big a problem for a mental health professional, be it any professional or an individual or a parent, to solve on their own. We, as global citizens, including the young people, are facing a series of challenges which has torn the fabric of our societies. Using technology to stay connected, in addition to leading healthy lifestyles and developing innovative coping mechanisms, building resilience, including a positive attitude, is more than crucial in safeguarding our mental health and well-being. Thank you.
Students can ask any questions if they have.
Thank you, ma'am. Myself, Shrina. So, this is the problem of the COVID. I don't think anybody will open up their mouths. And I don't know how many of them had in their life um, uh, any problems. Maybe somebody might have, some relatives or some very close people might have passed away, or, all these problems they faced. And they all these students are uh, uh, very communicable in an online platform, or maybe they just communicate very easily in WhatsApp or Insta. But when they were asked to open up in person, nobody will speak anything. So I probe the students, why you are not asking questions. You can share the problems that you had when you might have got COVID, or your family members, you know and this is a platform where you can open up. uh, Maybe this is an after effect of COVID, that nobody is asking questions.
Yes, ma'am. In my clinical practice, also, what we see is that the children, especially the teens, they they live a life in virtual media. So what they see in real, what they don't want to see in real, they tend to live in social medias. They tend to portray themselves as a different person, share their problems, uh, get trying to seek help from others, but may not be the right way to do so. So when you have an opportunity to ask, I think you should make use of it. You may have a lot of doubts and misconceptions, but this is an opportunity for you to get clarified it with. Okay, there is no wrong, or there is no harm in seeking help when you are given such an opportunity.
Namaskar, Dr. Arya. Thank you. Thank you for your presentation. It was really useful, and thanks for opening our eyes towards some medical issues that we were not directly in contact with. Ma'am, could you tell like some statistics, like how many children came to you with severe mental issues during this time because of COVID? And in that connection, I would like to highlight that we have been having such epidemics, definitely, in our past also, like cholera or smallpox, which has killed so many people, so many children. And there used to be a time in Kerala where hardly any children survived after the aftermath of smallpox and cholera. But still, perhaps people did not, they were not, they could maintain mental balance during those times. And these times, although we have survived more, but still we are not able to maintain our mental balance. Could you also point out what is the reason for this and how can we overcome it, ma'am?
Yes, ma'am. So what we have had is that very small children, like less than 10 years of age, they came to us with problems of, getting addicted to mobile and fear of separation from parents. and fear of parents getting COVID infection, and anxiety of parents' death. So these were all their symptoms. But little bit older children, like from 12 years to 19, 20 years, they came with more substance use problem and difficulty to attend classes, and sleep problems, so relationship issues. So these were the majority. So and more than that, parents brought children because of the decline in their academic performance, because children were not used to this online facilities. They did not know how to cope up with the stress, and having to pass major exams in their life, maybe 12th standard, 10th standard, yeah, the exams getting postponed, cancelled. All these things were causing significant anxiety issues and sleep issues in those age group. And I would say, ma'am, those olden days people were more resilient. Okay, they know, being, having lived in a joint family where there are more people to interact with, people were more, kids were more resilient to stress. Nowadays, the children, they don't know how to handle stress, and they don't have an inbuilt coping mechanism on how to deal with the stress. And more often they are not, they're very reluctant, even if they are brought to a psychiatrist or a mental health professional, they're not willing to open up. So I think they feel that they are being judged or something, and what if they consider me as a weak person, or should I talk to this person about it? And somehow they don't seem to be very confident, or maybe they don't seem to be trusting people, or a professional healthcare worker like they used to. And one more thing is that I think stigmatization, the stigma of approaching a mental health professional is still not gone. So they feel that they will be considered as a mentally ill person if they come to a professional in that matter. So I think the best way to survive this is to enhance their coping skills, coping mechanism, find alternative ways to use their time judiciously, and to maintain and build more relationships, such that more resilience is built.
Thank you, ma'am. Ma'am, there is a question posted in the chat box.
Okay.
Is it visible?
Yes, I got that. I was hit by a low self-esteem. How can I do new rating? Okay. See, low esteem, which means that your confidence was a little reduced. Is that, I think you meant to say that. So how can you build confidence is what you want to know. So what has changed? It is a change uh, which we are all going through. It is not only for you. Okay. And we are all this situation, although we have had so many pandemics in yesteryears, uh, we are going through this for the first time. Okay, so there is natural to have a reduced confidence, reduced self-esteem, because we don't know how to deal with this. This is an entire change from our daily routine, the systems which we are not used to. So getting adjusted to that will take some time. But if it is persisting beyond a certain point of time, you may have to talk to a professional on what your problems are, and see if it needs any management, or it's just a what do you say, just a counseling will help. So you need to see where your problems are, what your problems are. Are you having confidence in your, confidence about your future, reduced confidence about your future or your studies? Do you feel that, this has affected you significantly only in your academic performance or in your all, spheres of life? So you need to express more on that. So in a general way, how can you increase your confidence? Is that remind yourselves that this is nothing permanent. Okay, this is just a temporary situation. We are all going through that, and you are not alone in this. Okay, so ultimately we will all come out through it. So this doesn't have to have a permanent impact on your confidence. So if you want to talk more about it, you can always come to us. We will try to help you, and we will sort out what the problem is. I hope you don't have any sleep issues or anything of that sort.